So in talking about the financing of long-term care, it helps to be reminded of this simple question of why is long-term care a policy issue? Why are we talking about this? And there are four basic reasons. First one is that there are high costs involved in providing long-term care, both for individuals and for all of us as a society. The second is that the risk of needing long-term care is a risk that is facing everybody, and it is largely an unprotected risk. A third reason is that the costs of these services not only are high, but they are increasing. And lastly, the social programs, what we think of as a safety net, is inadequately financed right now and very poorly coordinated. So we're going to talk more about these particular reasons for why long-term care is a policy issue, and they all relate to the financing. This slide shows you the national spending for long-term care by different payers. This comes from 2011, which is the most recent data that we have on spending for long-term care. And you can see that the total amount that we spent on long-term care services was $357 billion, or I think of it as $360 billion. Just keep rounding up. And this includes spending by Medicare, which I'll talk about in a second. And the first thing you notice is that the biggest payer is the Medicaid program. It pays for 2 out of every $5 that we spend on long-term care services. The second biggest payer is the Medicare program, which pays for a little more than 1 out of every $5 that we have spent on long-term care services. Medicare, however, only pays for long-term care services if it follows an episode which we define as an acute care episode, which generally means the person has been in a hospital overnight for at least 3 nights. So right away, there are a lot of people who need long-term care services in terms of these activities of daily living, which do not involve after being in a hospital. So Medicare really is paying for long-term care services that are rehabilitative. The notion here is that maybe you had a stroke, maybe you fell and broke your leg, and you need some amount of skilled nursing care, generally provided in a skilled nursing facility or a nursing home that has a skilled nursing facility, or at home with nurses and physical therapists, occupational therapists visiting for some short period of time. So if you have Medicare paying for long-term care services after one of these acute care episodes, Medicare only pays up to 100 days for being in a skilled nursing facility. After that, the person is on the hook for paying most of the care. Or if you are getting these long-term care services at home paid for by Medicare, it's in short periods of time, like 4 weeks worth of services. And then a physician has to certify that it can be for another 4 weeks worth of services. Always there is a nurse involved in supervising this along with the physician, and these types of services do not include any amount of homemaking or housekeeping kinds of care. And then you can see on this slide that there is other private and public, which represents 18% of all long-term services. That's where the Veterans Affairs Department, which pays for long-term care services of veterans, the money is in that piece of this pie. And then, of course, you see that 15% of all spending for long-term care comes out of pocket from the people who are actually receiving these long-term care services. And private insurance, that little sliver of 7%, the fact that it's only 7% really is reflection on how few or small the number is of people who have private long-term care insurance. Long-term care is expensive. The median annual cost of nursing home care in 2013 is $84,000 for a semi-private room. When we're talking about median, we're saying that half of the cost of nursing home care is greater than $84,000. And this is a semi-private room, which means that you are sharing a room with somebody else. And I don't know about you, but I have not, other than my husband, shared a room with anybody since I was a freshman in college. And most people really don't like sharing a room with somebody else who may wake up in the middle of the night and groan or want the TV on. It is not private. We call it euphemistically semi-private. If you are getting long-term care services at home, the cost of that home care really depends on the level of need. That is, how many of those activities of daily living do you need help with? So if we, just for round numbers' sake, use $20 an hour as the wage or the amount that you would pay to an agency for somebody providing long-term care services, and the person needs 24 hours of care for 365 days a year, we're talking about $175,000 as being the cost for getting care at home. And I should warn you that $20 an hour is an underestimate. You probably ought to be multiplying by $25 at least per hour. Which means that a lot of people are getting unpaid or informal care from spouses or parents, if we're talking about young adults, or from friends or other relatives. And this has direct and indirect cost implications on the people who are providing this care. In particular, the indirect cost implications relate to their stress in providing this care. There is a fair amount of evidence that people will die within, if we're talking about a couple, that this spouse who survives the one who dies will die on average about 6 months later. And it often has to do with the fact that they became exhausted and sick themselves. In addition, it is the case that children or a spouse who may not be earning a lot of money is really in a bind, in the sense that they want to buy more care for the person who needs these long-term care services, but to be able to pay for that, they have to work full-time. So one of the issues here in terms of indirect or direct costs, depending on how you want to think of this, is that the caregivers themselves feel that they can't do much more than what they already are doing, and that's why they often are asking for help, both paid and unpaid, to help care for their loved one. There are, in addition, social costs related to long-term care. As we saw in the pie chart, in 2011, the total amount of expenditures, that is paid care, was about $360 billion, or 13% of total U.S. spending on health care in 2011. And this number does not include the unpaid informal care. About a fifth of that paid care, as we saw before, was paid for by Medicare for post-acute care. About 40% was paid for by Medicaid. And when Medicaid pays for long-term care services, those services account for about a third of state Medicaid budgets. So you can see that the social costs are huge. And these are projected to grow substantially over the next 2 decades as baby boomers are going through this threshold of age 65, which they started doing in 2011. Here are some projections of the numbers of future elderly and long-term care spending. And you can see the effects of the baby boomers right here in this slide. In 2010, the percentage of people 65 and older was 13% of our population. By 2030, so we're talking 16 years from now, the projections are that the people 65 and older will account for 1 in 5 Americans. And it has the same impact in terms of rapid increase in terms of the percentage of our gross domestic product that is spent on these services for long-term care. And by that I mean we're talking about paid services, not the unpaid services as well. When we look at the need for long-term care services, it is important to remember that we're talking about this in terms of if you reach age 65. So we are not including people who die before age 65. And as this slide shows, you can see that there are about 30% of all people who reach age 65 who are lucky. They will not need any long-term care services. They will not need help with these activities of daily living. But that leaves 70% of those who reach age 65 as being in need for some form of long-term care services. And as this slide shows you, we can look at this both in terms of the number of months or years that they need help or the amount of money that they are likely to spend on long-term care services during their remaining lifetimes. So if we look at the lengths of time that people are in need of long-term care services if they reach age 65, you can see that about 20% are going to need services for more than 5 years. Now, some of that help may be pretty minimal in the first year, but by the time we're talking about 3 and 4 and 5 years and more, we're talking about really a lot of assistance with the activities of daily living. You can see this reflected in the amounts of money that people are projected to be in need to spend on long-term care services, or to think of it another way, what it's going to cost. And the first thing that hits you is that about 42% don't have any expenditures. They are going to get long-term care services largely from friends or spouses or family. In fact, if you look at it in terms of do you have to spend less than $10,000, it's about 62% of all of the people who reach age 65 have pretty small expenditures. But then go to the right-hand column, and there you see that about 16% of people who will need long-term care services during their remaining years of life after age 65, they are going to be spending more than $100,000. And these numbers of dollars are in 2005 dollars. So if I were to bring this forward to 2014, I am likely telling you that around 16%, 17% of those who reach age 65 will spend well over $130,000 on long-term care services. These are real risks. And then if we think about this in terms of what types of need a person might need given that they're living in the community, you can see again these same kinds of numbers I showed you on the previous slide. So about 28% of the people who are living in the community will not need any care at all, and another 47% will be able to rely on just help from friends and relatives. But that leaves us about 19% who are going to rely both on informal unpaid care from friends and relatives and some amount of paid care. And then the number I really want you to focus on is this 6%. 6% of those living in the community have to pay for the long-term care services that they're getting because their needs are great enough that those services cannot be provided by their friends and family. So we are talking about a small percentage, which means it's a pretty small risk, but it's a very costly or catastrophic risk. And this is a risk that everybody shares. So even though we can talk about the previous slides with people who don't need any amount of care or really won't spend very much money on it, they are still in the general pool of people who have a risk of this 6% where it may cost them a lot, even living in the community. And of course, if we add in those who live in a nursing home, then that risk gets higher. So, in sum, I want you to remember that this risk of needing long-term care is somewhat random. It is a small risk, but the expenses involved are catastrophic. Most people cannot afford these expenditures that are well in excess of $100,000, and they certainly can't be involved in it with a time horizon of more than 5 years if they're having to pay for that care. So next we're going to look at the unpaid care and the role of unpaid care and Medicaid in talking about long-term care services.